We're celebrating 50 years of the Macmillan Unit at Christchurch Hospital this year with lots of celebrations, and we are looking back at the last 50 years and also looking forward to the next 50 years. What do you think has changed in palliative care and end-of-life care in the last 50 years?
I think one of the main things is we use the word complexity a lot, but what that really means is that people are living longer due to the successful cancer treatments. So people are living longer but having more complications in their longer life. So whereas there were some illnesses where someone would die quite quickly, they'll live on until the disease has moved into different areas and, for instance, into their brains. So we have lots of people that come and use the beds that have got lots and lots of different problems, and then they might also have some other things like some heart failure or problems with their kidneys. So it's a very, very busy place, and the people that are needing the beds have a lot going on and need lots of support with their symptoms and their distress.
So looking at care in the Macmillan Unit 50 years ago and the care that's provided today, it's a lot more complex, and presumably more nursing staff and doctors are needed to provide that care?
Yeah, that's what I understand. I've worked in palliative care for 17 years now, and even during the time that I've nursed, I've seen a really big difference. And then, of course, the pandemic, where people were changing in terms of their needs, the pandemic's really made that happen a lot quicker and a lot bigger in many ways. So some of the things like the day centre that we used to have, we needed to close that in the pandemic because it stopped being the right thing to do, bringing people in when they were vulnerable to mix. And actually we left the day centre closed for a couple of years and started noticing where the need was. And we met a lot and talked about it, and we changed our focus to developing hospice at home to keep people closer to their home. So we've seen a lot of change in the needs of the patient group and the families as well. There's a lot of need to support families through their distress.
So is it fair to say that the service has adapted to the changing needs of our patients? You mentioned about hospice at home, providing that care where the care for the day centre is no longer there, providing the care that's needed now for people who have more complex needs and need that care out in the community as well as in the hospice itself.
Yeah, I feel really confident that we've adapted to meet the needs of our local community. We're a very busy place. I think talking to Mary previously about how many admissions they'd have in a day, it's not uncommon for us to have 3 new patients come in a day, and they really need that bed, they really need the support, and quite often their family surrounding them are quite distressed. So I think we've adapted, we've become a very busy and effective place, but we've managed to not lose the foundations of what a hospice is all about, focusing on what's the most important thing for that person and their family. So we've managed to adapt to the changes but keep the kind of core of what we do as it should be.
Lou, looking back 50 years, Dr. Ronald Fisher was the first consultant here and the person who set up the hospice initially, the first of its kind in the country, the first NHS hospice. Sadly, he's no longer with us. I never had the opportunity to meet him. But if he was here now, what would you say to him?
Well, a massive thank you on behalf of all of us and for the thousands and thousands of patients that have benefited from the care at the Macmillan Unit or the services that the Macmillan Unit provides in people's homes. But also being a kind of senior leader for the service, I can't imagine how difficult it was to sort that out. So thank you, but also just it's such so much admiration for the challenges that he must have faced in developing the first NHS hospice.
You of all people know what it's like to try and set things up. So we can only imagine, as you say, what it was like for Dr. Fisher back in 1973 and 1974 to arrange the funding, get our community to fund it, and also arrange for the NHS at the time to be able to start their first hospice in the country, of which we're incredibly proud. And may I thank you on behalf of all our patients and all their families for everything you and your wonderful team
Thank
do
you.
to help them. Thank you, Louise.
Thanks. And thank you to Mac Caring locally for everything that you do to support all of us, because this service wouldn't be what it was if it wasn't for the charity. So we are equally thankful to you. So thank you.
Thank you, Lou.